Right, John, thanks for coming, mate. You've had a long trip.
Yep.
Why are you wearing dark glasses?
The reason I wear the dark glasses now, John, is I've kind of got neurological issues, so I don't know what you call them, I don't know the terminology for them, but it's black eye floaters, so it's kind of like these floaters. So they're really, really strong, and when I wear the glasses it kind of helps blend in, so it really helps. So I'm also sensitive to light as well, and I've got neurological issues, so kind of standing on, when I stand up I feel like I'm on a boat. It's kind of like this off balance, awful feeling. And yeah, so this is why I wear the glasses. So it's not to look cool or anything like that.
No. So obviously you've got a vaccine injury, and we want to go through that. But I want to go back. So take us back, 2020.
Yeah, no problem.
You were fit. You were.
Well, I'll go back to 2019 because I like to say to people, you know, I've been royally screwed over by whatever the hell this thing was, and the thing that was supposed to protect us all. And the reason I kind of elaborate on the story is to kind of show people that someone like me should never have touched that vaccine. And you know, they told everybody it was safe and effective for everybody, but in my case I should never have touched it because whatever it was already in my system. So going back 2019, fit and healthy guy, extremely fit, could do CrossFit. You know, I worked 9 hours a day on my feet, joiner, carpenter. I was working on one of the biggest building sites in Edinburgh at the time, so it was the St James Centre, which is one of the biggest building sites in Europe at the time. So at that time, I'd been away to South Africa. I go there every year, I've got a family over there, and I came back, you know, started my work back after Christmas. Always go about January time to get away from this, especially in Scotland. So I went to South Africa, came back from there, you know, still hitting the gym, perfectly fit and healthy guy. Roughly about February time, at the start of the week, I still got the text message on my phone, and I started to develop some sort of cold.
So this is February 2020? February
2020, And I developed this really strange cold. But you know, the thing was, John, I had a night out it was my last ever proper night out with my mates.
As you do,
And so what happens with me is when I know my body, you know, so when I have a drink I'll tend to I call it a 3-day hangover, Sunday, Monday, Tuesday. But what I usually do is I usually like to go to the gym to sweat the negativity out, right? But this week I wasn't feeling good, I had this cold, I'm thinking, you know, I've been in a night out, you know, I've been out in the piss, and I'm kind of just like, I'll go back to work. So I didn't go to the gym on the Monday, Tuesday, Wednesday, but this thing developed worse and worse. So the Friday, I went like, I'm going to get up, I'm going to go to my work, and I'm going to go to the gym after. I'm going to sweat this out, whatever the hell this is, because I always seen that a cold is you know, you can sweat a cold out. That was just my kind of thought back in the day.
We could talk about that, but yeah, it's what you thought.
It was just how my body was, you know. You know, like saunas and that, and I wasn't really a guy that got ill, John, because I was very, very into my fitness. I used to do boxing as well, so all the guys that knew me in the south side of Glasgow, you know, they all knew, and that's how they all knew there was a problem with this vaccine, because they said if that guy can't hit the gym, then we've got a problem. So the Friday came, I went to my work, and I remember it like it was yesterday, John. I was trying to put sheets of gyp rock on the wall, and I was going, what's wrong with me? What the hell's going on with me? So
this is still February 2020.
This is February 2020, So I ended up going to the gym, and I'm working out, and I remember going with this guy, and it was a new gym, because it's one of those pure gyms, so you can use different ones that are located. It's one of those revolving doors ones, you just need a code. So I went to a new gym in Edinburgh. Didn't know the gym, didn't really know the place because I'm originally from Glasgow, but I went with this guy, and I was working out, I was doing battle ropes, we were doing circuits. My chest started to get tight. I'm struggling here. I continued. So as it went on, it was getting worse, and then I had to say, I was doing holding pads, and I went like to him, I need to stop it, I'm really struggling to breathe here. So I get in the car, and I was dead cold as well. Usually I go home, have a nap, keep myself warm, but I just went straight from my work, I was really cold. So I ended up getting in the car, my chest is like, it's like a snake's wrapped around it. It's really bad. And I texted my partner and I said to her, you in the house, can you run me a bath? I said, I think I need to get this cold or something right here. So she ends up phoning me, and I'm just like, I'm not feeling good. You know, she went, I'm out just now. I went, okay. So I drive the car and I start driving round the corner. And then all of a sudden this feeling came over me, the feel of absolute shock. I didn't know what was going on. I literally threw the car over the side and into a row of shops. I abandoned it, you know, I just kind of parked, and I went, I told my partner, she went, I'll phone you an ambulance. She thought I was having a heart attack. I'm 34 at this time, 34 years old, you know, like 34-year-olds fit as me don't really have heart attacks.
Non-smoker.
Non-smoker, and so yeah, so I've jumped into I jumped into a shop. The guy looked like he had like 3 heads, you know. I walked in and I went, can you phone me an ambulance? He just kind of looked, I said, I can't breathe. Didn't do anything. So I ran into it was a Friday, remember. I ran into a hairdresser, and this hairdresser was swamped with women. They were all getting their hair done, whatever they were doing. And I'm like, can somebody get me an ambulance? I can't breathe. Eventually the ambulance come. Guy rigs me up to the ECG. He says, we think that you're having a heart attack. I was like, you know, I'm like, get me in, you know, they're way to get, I'm like, no, get me in the car, and they're just kind of looking at, you know, get me in that. So I dive into the ambulance, they fill me up full of aspirin, they run me into the hospital, and as soon as I get there, they slit me open, so I've got a slit there, and they put a stent into me. So after that, I'm sitting there and I'm total shock, you know, I'm total disbelief. I'm like, what the hell is this? So as things went on, the doctors turned around to me. Now, this is the thing, John, right? My understanding is that a heart attack, the troponin levels, which you can elaborate.
They would go up.
Yeah, but the troponin levels, what they say is for a heart attack, a troponin levels would usually be 20,000 plus.
Well, they could be very high, yeah.
But for mine, it was very low. It was only 6,000. So
you've still got some damage to the heart from that. Yeah.
So they were looking at my heart, and they were looking at going, the heart's fine. They couldn't make sense of it. So they took the ECG. They took I think they'd done an MRI. I can't remember. They put me on a stress test, which was one of the worst things they could have done. And they said, look, heart's absolutely fine. You know, you've got an athlete's heart. Wouldn't think anything of it. You'll be back up on your feet within, I mean, when can I get back to work? Will I be able to train? Will I be able to... They're like, no, you'll be fine. Look, we'll give you a stent. But this is the thing that gets to me. When you have a heart attack under the NHS, and this needs to be analysed in my honest opinion, but I don't think this was a heart attack now when I look back, because it didn't have... The cardiologists I've spoken to now, they've said, no, you've had some sort of inflammation around the heart. So when I walked out of the hospital, they said, no, up on your feet, you'll be absolutely fine. I'm like, okay. And they give you a welcome pack. They give you a welcome pack to a heart attack. I was on all these drugs, John. I went from a guy who took absolutely nothing
to the whole cardiac,
to the whole shebang of an 80-year-old person with a bad heart. From cholesterol, blood pressure, aspirin, which I still take to this day. That's obviously to keep the stent going.
So they put a stent in your heart?
Right coronary artery.
Right.
It was. So I still haven't really seen the evidence to see why they've done it. I've only gone by what the doctors have said. But so I started taking all these pills, but then I started having all these weird issues, which was some were neurological issues, but I was having these things called what I understand now, which is adrenaline dumps. So I would be, bear in mind that this was around about 21st of February, I think coming up to the actual, what was it, 2020, so 4-year mark. So bear in mind the lockdowns happened in March. So I remember one night just sitting there, and this feeling came over me of this total, I'm going to die. Ambulance again, rushed into hospital, everything's fine. everything's fine, everything's fine. They kept saying the same thing to me, John. They kept telling me everything was fine. My understanding now is, whatever this thing does, it affects the nervous system. So that could be a vagus nerve issue, which is totally adrenal glands. I'm not sure. You know, I'm not a doctor, John. I'm just trying to get an understanding of why these things were happening. But March came on. I was having these dumps all the time. But then they gave me psychologists, and they said that I had health anxiety from whatever this. I don't think it was a heart attack now. I think it was something that
the cardiac symptoms.
But yeah, well, inflammation around the heart, my understanding is, can mimic a heart attack.
It can.
So as things went on, I was having all these issues going on, John. It was constantly in and out of hospital. I was telling them I've kind of got now. I had neurological issues going on then in 2020 after this episode, whatever it was.
So basically you're having cardiac issues and neurological issues, and looking back fairly clearly, these were COVID effects, weren't they, from COVID infection?
Well, I mean, you know, John, I'm not a big fan of calling it COVID anymore, but that's just me the way, you know, to me now, I don't believe, I could go down a different route, but I'm not going to, but whatever,
you had something there.
Whatever this, it could, you know, if you look at actual flu symptoms, it could have been flu. I don't know, John, this is the thing, but it wasn't what they were telling us all in the news. They said, you know, respiratory issues and all that. This was totally different for me. And like I said, what I'm going through now is nowhere near what I was going through back then. So as time went on in 2020, and I don't want to stay on 2020 for too long, I want to kind of move on from it. They kept telling me it was in my head, they kept telling me. So I experienced the gaslighting from the NHS in 2020, and it was really frustrating, John. They were giving me all sorts of antidepressants, and they were giving me everything. They were telling me it was in my head. They weren't analysing me. Going back to the pills they gave me for the heart issues, why was I on cholesterol? Why was I on blood pressure tablets? I had to question the doctors and say, you know, statins as well. And then when I look into statins, I don't take your statins. Why would I take a statin when I don't have high cholesterol? Why would I take high blood pressure? They were making me worse, John. So again, this is the issue we've got. We're just taking it. That's what he said. There's a bunch of pills.
Yeah.
That really frustrated me. I just felt like I wasn't getting listened to in 2020.
Yep.
As time went on, I started to get better. Now I did have issues, and people listening to this, they might actually be like, that's actually what's happened to me. I was having these issues. I felt like I was really low in blood sugar back then. So I started eating a lot more things, like I was craving sugar. So I put on a bit of weight. I'm not going to lie to you, like I didn't really work out because I was scared. You know, I was scared all this stuff was going on. It was all new with me. But as time went on, John, I was getting nowhere with them, with the NHS. You know, they were telling me my heart was fine. They were telling me it was all in my head. That's when they decided to say I had FND, which is functional neurological disorder.
Yeah, functional means it's not really biological, doesn't it?
So basically my understanding is FND is actually quite new. And I told them I had this and they said your FND is called triple PD. So PPPD, which is postural perceptual something dizziness. This is what they called it. Okay. So basically you've got neurology now, and then you've got an umbrella term FND, and then it comes out again. Whereas before we just had neurology, then we had these issues, but now we've added now. You know, John, is this just been something that they've kind of pre-planned? I don't know. I can only assume. But so anyway, as time went on, I was getting nowhere with the doctors. And I ended up discovering a man called Wim Hof, which is the Iceman. Everybody knows. And I ended up actually following his breathing techniques. He does the cold water stuff, but I started doing his breathing techniques, and I'm a big advocate for that now. His breathing technique. The first thing I started to notice it was calming down, John, was these adrenaline dumps, was these panic attacks, these awful panic attacks. Now, John, I want to tell you, this is one thing that I really want to get across to people. The NHS, at one point, they made me suicidal. And they didn't just do it once, they've done it after me, what's happened to me after taking that jag. I managed to get better from 2020. It took a while, but I managed to get better, John. Managed to get back to the gym, managed to play golf. Wasn't 100%, but at least I was living life. So that was pretty much my experience in 2020. So when people talk about the pandemic and stuff, for me, pandemic was getting over my health. And not only that, I started building a family business as well. So I was actually working on it, doing paperwork and stuff. Never really seen anything apart from what was in the news. Never really seen anything. My opinion now of, I don't like saying it because I think it's been man-made. That's my opinion. My opinion is that at the beginning it was doing what it was meant to do, but I think my understanding is as time went on it got weaker and weaker, and it wasn't doing as bad a job as it is now. And the people who passed away from it, I think now it's the protocols that have been put in place with the midazolam and morphine, and I know that because I do my own podcast, John, as we spoke about, and I've interviewed people on that have told me about horrendous things that happened to their loved ones. And I would really tell people here watching, if you do have questions about if your loved one passed over, I would say request the doctor's notes, because if in those doctor's notes, I mean, tell me if I'm wrong, John, but in those doctor notes, if you've had midazolam, morphine and a ventilator, you didn't have a chance.
No. And the medication record should still be there.
Yes, so that's what I would really like people in the UK to actually take that on board, because we have to get an understanding of, did they ramp up the numbers? Because we do know that they manipulated the data regarding that. We do know that people went in with different things, John, and it wasn't whatever this thing is was in their system. But I do believe it done a number on me, but I managed to recover from it from a good bit, like I said, over time. But like I said, people need to request doctors' notes. We need to start asking questions, because if we've got a list of people who died from COVID and they don't have these protocols in place, we can put those numbers together. If we've got people who had COVID and had these protocols in place and there was a death, it means we can get true numbers, John. I mean, tell me if I'm wrong.
Makes a lot of sense to me. We need to know I agree. We need to look back and work out why people died, and relatives have a right to know that.
I mean, I know you're interviewing me, but just regarding the midazolam and morphine, is that true? Would you say that's kind of true?
They're contraindicated. We know now that you shouldn't give them together because it can stop people breathing.
So the question is that if they're doing the same protocol over and over and they're getting a consistency, you know, was there any survivors from that protocol? These are things that need to be kind of questioned.
It's a very good question.
That's something that needs to be asked. You know, did anyone actually get the midazolam, morphine,
and survive, and
the ventilator and survive? So you know, it's common sense plays a big part here now, John.
Yeah.
But
your story, John. So you were getting progressively better over 2020, and then into 2021.
2021, business just opened up. Literally, as lockdown opened up, it's a clinic. You need to do HIS, which is Health Inspection Scotland stuff, and you need to do proper paperwork. You need to go through the right rigmarole. All this nonsense, John, which I think people need. It's just ridiculous. The money you make to try and open to make money is ridiculous.
Yeah.
So we were opening up, and I was just focusing on that, focusing on playing golf and living life. 2020, you know, the talks of the. Can I say the word? Am I allowed? Because what vaccine?
Oh yeah.
The talks of these vaccines or JAGs. I call them JAGs.
No, we can call them jabs. We can call them.
I call it
vaccinations.
In Scotland, we can
call them gene therapy if you want.
Well, that's true as well, isn't it? Because it's been proven now. Look at Alex Mitchell. His genes have been changed. Has mine been changed? I don't know.
Well, it was a genetic instruction that was given. That's beyond dispute. Yeah.
So basically, the talks of these vaccines came about. Now, the honest answer, out of everyone I knew, the only person that questioned it was me.
Yeah.
I'm talking guys I played golf with.
Yeah.
I'm talking about family. I know people that are doctors. I was the only one questioning it. I didn't see anything regarding adverse reactions and stuff. I took the first one, but then as time went on...
So when's this? Is about, what, March 2021?
I think it was...
Roughly.
I think it was because I'd been in the vulnerable category now.
Yeah, because of your previous condition.
Yeah.
So I would have been quite early, yeah.
So because I was in the vulnerable category, and like I said, John, I was back to... not full health, but I was back to being normal.
Yeah.
And I was back to, you know, doing whatever. So AstraZeneca came about.
So this is probably about February 2021.
Yeah, I can't remember the exact dates, but
yeah.
I took the first one, you know, don't remember any side effects from it.
Okay.
Took the second one.
So that's what, just a couple of months later, or?
Yeah, it was like I might say maybe May, June.
Yeah.
When I started to take my friend, I got a good friend, and his name's Mick, and I always give him a shout out. And he was going on about, then he started to send me stuff and say this, that, and the next thing about them, right? But he was the only guy telling me, you know, there's a problem with these. Now, I want to say maybe after a month or 2 months, I remember I was down in London.
After your second?
After the second one.
Yeah.
I was down in London, and I remember I had this reaction that was really weird, and I felt like I was going to pass out. And I remember I had to go into a cafe, and I genuinely thought I was going to die, John. And I laid down in that cafe. Now, because of my previous with all these adrenaline dumps, I just thought I was relapsing. I just thought, now before, by the way, just to let you know, before 2019, John, I never seen a doctor. And that's why I don't understand why the doctors never took me and went, how have you just went from that to that? And now he's constantly at the doctors. But it got to the point I was banging my head against the wall with these doctors. That I just felt like there was no hope in there. So like I said, I got the Vim off. So I remember having this feeling of passing out. So again, as time went on, that went away. Back to golf, back to normal, doing what I have to do. The rollout of the booster comes along. I was like, no, I'm not doing it.
So this is towards the end of 2021?
November time. Or maybe before that, but the date was November.
Yeah, that's when I had my last one.
Yeah, but November time. Yeah. And...
It was November.
Yeah. And the letter came through the door. Now I turned round and I said, nah, not a chance, I'm touching it, I don't believe in it. Now, going back to what I said about going to South Africa, get family in South Africa, you know, they've had new babies and that, and we want to go over and see them. And the new Omicron variant had came out in South Africa. That's where it was supposed to originate.
That's right.
Yep.
That's right, yeah.
So in order to get into South Africa, they want you up to date with your vaccines. They want you up to date with that booster jag. I was just like, this isn't making sense. But my mother, she's had cancer 3 times, John. She's scared, she's in fear. My brother's taking it. My mother's taking it. My mother actually had a reaction now when we look back. Yeah, she had a weird reaction. Now that we look back...
Just didn't recognise it at the time.
Well, she had a curry.
Right.
She had a curry and she had this weird reaction. But I think I now know what it was, which might be the MCAS, which I've told you about. We can touch on that.
Yeah.
Where was I going there with that, John?
So you were going to South Africa?
Going to South Africa. We paid £1,200 for flights or something, something ridiculous.
Yeah.
They want you to go to get your vaccine. Passports were coming into play. You know, this whole passport thing.
Yeah.
I'm like, nah, I'm not taking it. Turned into an argument with my partner.
Yeah.
You know, I don't blame her. I don't blame anybody for this. I blame the people that were coerced us all and lied to us. Family think they were just protecting us all, John. You know? But I can't change the story because this is the story.
We were told it was safe and effective, weren't we?
I was told it was safe and effective, and it would protect me from giving it to my mother who was scared.
Yep.
And we just didn't... John, I never thought vaccines could harm anybody. So I don't hear anything like these stories. I don't hear them. The blue letter came in the post. I remember taking it in the fridge and threw it in the bin. Turned into an argument. I was like, nah, I'm not touching this. So I ended up caving, don't I? And she went, you need it. And I went, fine, I'll take the fucking thing. So we went and took it. The worst thing I'd ever done in my life. I remember one time, John, I don't know what one it was, but I remember sitting there in front of one of the nurses. Like I said, I can't remember if it was the first or second or third one. And I turned around to one of the nurses and I said to her, I don't know if I want to take this. I don't know if I trust this. She was like with the syringe, it was already in her hand, she just put it down like that and looked at me and said, I know people who didn't believe in the virus, John. I know people who didn't believe in the vaccine. Do you know what happened to them? They caught COVID and now they're dead.
The nurse told you this?
That's what one of the nurses said when I was at that vaccination centre. What are you meant to do? When you've got a health professional, I'm just a joiner. What are you supposed to do when you hear that? And you're thinking she sees these things. So of course I took the third one, John. Now I've got the pictures in my phone and I'll show you.
Yeah, we're going to show those when I have these together, John.
After that, because I argued with her, I said I'm going to get myself a PlayStation 5.
Why not?
Like a big child. And I've actually got a picture of me with it in the background. Next day, didn't feel good at all. Fatigue, heaviness, like lead was strapped to me.
Day after the vaccine?
The day after, like fatigue, but that was kind of expected, wasn't it?
Yeah.
They kind of said...
Yeah, they said it could happen.
Flu, whatever. And then after that, I think it was the following day. Now I felt like crap. And my friend came...
Yeah, so 2 days post-vac.
Yeah, so my friend came and visited me. It may have been 2 or 3 days, John, I can't remember, but it wasn't good at all.
Within a few days anyway.
Yeah, so I remember my friend came over and I was like, I'm not feeling good, I'm sluggish. And he went, Mum, we'll go to the gym. We'll go to the gym. I went, right, okay, I'll try and sweat it out. Like I said, I'll maybe shake this off.
Yeah.
Now I wear this watch. It wasn't this watch, but it was one of the older versions.
Yeah. Tells you your heart rate and stuff.
So I used to wear the watch to keep an eye, working out and whatnot, how many calories I burnt. Now I went to the gym, John, and I remember, I think it was before, the watch, these things detect if you're exercising. The watch thought I was exercising. The watch said to me I was running. I had a wee picture of a running man on it and it says you're running. So it already thought I was working out. I was just standing there.
This is in the way, right before you'd done anything.
My heart rate was just, went through the roof.
Yeah.
I went in and I started pushing weights. And instant fatigue. And this is in the gym. And then I didn't feel good, pushed the weights again. I went I said, I'm not feeling good. So I went down, lay down in the mats. I only done 2 exercises, and I'm like, I said, look at my heart rate, it's 160 beats per minute. I was like, what is going on? So now I forgot to mention that, see, beforehand, after the AstraZeneca, I actually started having blood pressure issues. So I forgot to mention that. So just to go back a few months before, after that instant that I said to you,
this is after the second vaccine,
I was having blood pressure issues, which wasn't making sense, but now I look back, it makes all sense. It's having these blood pressure issues.
So you were just checking your blood pressure and it was high, and
they put me on blood pressure tablets. So I started to So I'm not even putting it down to the vaccine, right? I'm thinking I've got blood pressure issues. And I said, the blood pressure tablets aren't agreeing with me. I went like to my mate, I said, I'm not feeling good, I'm going to go, let's go for a swim. I went into the pool, John. This is hilarious. I went into the pool and this feeling came over me like I was going to just drop. Yeah. I got up, I walked over to the corner, there was a lifeguard. Now what was funny about it was, there was actually a first aid course going on. I said, honestly, you couldn't write it. And I was like, and I said to my mate, got to my mate's like, you're not looking good. You're not looking good at all. And I went, can you do me a favour, go and get... So they came over. Everyone that was in this group, I says, look, can you get away from me? I only need one person. I says, phone me an ambulance. I think I'm dying. They took me away, ambulance was taking forever.
Is it still in your swimming gear?
This is me in my swimming gear. They've taken me into a room,
yeah,
and I've laid on the floor. Went into hospital. Nothing wrong with you. Can't see anything. I'm like, right, okay. As time went on,
so your heart rate is 160, but there's nothing wrong with you.
Well, again, I was just going by the watch. I said my heart, you know, but they didn't look at anything like that, John. To be honest with you, they just took me in. Now, bear in mind that I was going into hospital before, but the issues. Yeah. So they were using that against me to say he's got health anxiety. There's nothing wrong with him. Yeah. They weren't analysing.
You had a label,
but I thought it was a blood pressure medication. So I'm like that. So we changed the blood pressure meds. John, I went through about 20 different blood pressure medication. I'm not kidding on. And I was going on to blood pressure groups on Facebook, and I was saying to them all on Facebook, does anyone get this? Do you get this dizziness? And as time went on after that, I just went worse and worse. Like, I started vomiting every day.
Is this after your third vaccine?
After the third one.
Yeah.
I was vomiting every day.
Yeah.
As soon as I woke up and opened my eyes, John, I was vomiting, retching, couldn't keep food down. Back to hospital, nothing wrong with you. Back again next day, vomiting. The vomiting was getting that bad that there was speckles of blood in it. And I thought that there was an issue, but they kept saying no, and I didn't understand what was going on with me. I understand now, didn't understand then. And it was just a constant in and out of hospital, John. No analysing me, no nothing. Now remember, because my stomach was that bad at one point, we were trying to find answers. So I was going to go and do acupuncture. We thought, you know,
just desperate to try something.
And we thought maybe this was stomach issues, because there was so many symptoms, John, that I'll read them in a minute.
Yeah.
Because it's not, but this is kind of building up to the rest of this story. And I remember getting ready, John, and I was in the house, and I stood up in the living room, and my heart squeezed and clamped. It felt like somebody had reached into that heart and twisted it I'd dropped to the floor, like instantly dropped.
Severe pain.
It was a pain I've never felt before. It was like someone twisted it, and it was this pain of, it was horrendous. I didn't know what was going on. I can either touch on what I know it is now, or I can touch on it when eventually it's up to yourself.
Well, tell us what it is.
So basically, going on what I think it is.
Yeah.
And it makes common sense to me.
Yeah.
There was obviously inflammation around the heart from the vaccine.
Or in the heart. It could be pericarditis or myocarditis.
But they've done blood tests to say. Now the other thing as well is, every time I went into that hospital, they always said my troponin levels were slightly elevated.
Yeah.
Slightly. Now I had a condition called POTS, which is the postural orthostatic tachycardia syndrome. The inflammation around the heart, you took the myocarditis, restricting the heart.
Yep.
And the POTS makes the heart go like that when you stand up.
Yeah.
Would that be true?
Yeah, it makes sense, because if your heart's not able to expand enough, it has to go quicker instead. I guess you would call it a chronotropic compensation for an inotropic deficit in medical terms.
So would you probably agree with me that could have been why my heart?
Yeah, that could explain your fast heart rate.
But the reason for the cramping, because if the heart's wanting to move and the inflammation isn't, I think there must have been a stress.
I think the reason for the cramping was probably your heart was going fast, and there was not enough blood getting through to your heart muscle, and probably with some inflammation as well. And what you were getting was the pain caused by the lack of blood supply to the myocardium. That is possible. Yeah. A myocardial ischemic pain. It's like an angina, but it's lasting for longer.
It was horrible.
Yeah.
But, so, you know, I can get to when we discovered the POTS.
Yeah.
But I went to the Chinese room. I was vomiting there. This went on for 6 weeks, John, and I was going in and out of hospital. And I was like, I'm dying.
I'm actually dying here. Do you not understand? I'm dying. I can't stand up.
Yeah.
I can't, you know, I had fatigue like nobody's business.
Yeah.
And I was in that hospital, John, and do you know one thing? I'll never forget this woman, and if I knew her name I would tell it, but I know the hospital. I went in one day, John, and I'd lost like 12 kilograms in weight at this point. All in, it was 25 kilograms in weight. All in, it was 25 kilograms in weight. But I remember going into hospital, and I'm like, I can't eat, I can't sleep, I said, look at the state of me, I was pale as, I said, I'm dying. She turned around and said, we've checked your bloods, checked this, everything's fine. I'm just sitting there like, how am I fine? I'm not fine. And at one point she turned around and went, what's your age, your height and your weight? She took my BMI. And she says, your BMI still says you're overweight. I advise that you seek mental health. You go and seek mental health.
It's all in your head, John.
It's all in my head, John.
Yeah.
But do you know where my frustration lies, John, is if they'd done that to me, how many others have they done it to? And how many have actually taken their own life because of it? Because I can tell you right now, I didn't want to be here. And the people that are supposed to help you are not helping. They weren't analysing me as a patient, John. But this is where my frustration lies, is because I know there are more people out there suffering worse than me. And I know there's people walking about right now and they don't actually realise that they're injured from it. I can't blame everything on it. But when I speak to people and people might hear this story, they might actually start to
connect the dots.
But like I said, and the reason I speak about what happened in 2020 is because the evidence now shows that someone like me should never have touched that thing.
You already had natural immunity.
Well, I don't know if I did or anything like that, but that is the honest answer. And
all three of your AstraZenecas were they, John?
It was 2 AstraZeneca, 1 Pfizer.
The last one was a Pfizer.
It was a Pfizer booster. And yeah, and so anyways, in and out of the hospitals, John, I was getting worse, and I had the worst Christmas in my life. It wasn't even like, it was terrible, John.
So pain, tiredness.
I didn't want to live, John. I didn't want to be here. I didn't have any help. The people that were supposed to help me, they wouldn't do it.
And you're a tough bloke, aren't you?
I like to think so. I mean,
but the pain and the distress became too much.
It's been the worst time of my life, John. And if I'm being honest with you, I don't know how I'm still here. And I'm not just making this up. But as time went on, the vomiting.
So we're into 2022 now.
Yeah, no, 2022. Yeah. Sorry, yeah, you're right.
Yeah.
Because of the stomach issues, I think I went and had, is it a Synapkin test?
Oh, I don't know.
What is this?
It's a gastrointestinal test.
So they were wanting to do, I went to a private hospital, and they were going to give me, they were doing all sorts of tests. We were doing blood tests. And I think we done this thing called a Synapkin test. I can't remember what that was for, to be honest with you. But we done a Synapkin test, came back fine, everything's fine, and I'm like, we paid private, you know, we paid money for this.
Yeah.
It's not cheap. Honestly, John, it was just, so
January comes around and I went to a private cardiologist because I was like, my heart's giving up on me. Everything's giving, my whole body's shutting down. I went to one in Edinburgh. I'd love to name his name, but I can't.
No.
Because he ended up taking me on the NHS, and then I found out the man was in Pfizer's payroll.
Yeah.
Later on in life. And I found out that man actually done a hit piece on Dr. Asim Malhotra as well. Because Asim messaged me to tell me. And I was shocked at that. And that man left me to rot. But he done a ECG in my heart and said the heart was fine. And at this point, I was in a wheelchair, John.
Yeah.
Quality of life was none.
Yeah.
So I ended up going to another private cardiologist for another opinion. And at this point, we're about 2.5 months later, and like I said, the side effects were ridiculous. I couldn't even regulate body temperature. Can I read out my side effects?
Yeah, of course, yeah.
So this was pretty much the symptoms I experienced.
Yep.
Nausea, acid reflux, stomach pain, diarrhea, fatigue. Like I said, I lost a lot of weight, 25 kilograms in weight.
Yeah.
Like I said, the dizziness and vertigo through the roof.
Yeah.
I've still got extreme, like I said, 2020 it was Kate, but now it's, like I say, I need to wear sunglasses all the time for the light sensitivity and everything else, you know. Faintness, I passed out like 3-4 times, constantly thirsty, constant dry mouth. And a lot of people hear this and they might be like, that might be me.
A lot of people are going to recognise these.
Constantly thirsty, high blood pressure.
Yeah.
Like I said, I was taking I just thought this was a blood pressure issue at the beginning.
Yeah.
The tablets, I thought it was the tablets that were doing this. POTS, slurring of words. Now I remember one time sitting in the house, John, and my mother's, because my mother had to care for me at this point. And I remember sitting in the living room, the television was on, my mother was having a conversation with her man. The phone went off and my brain couldn't take it all in. I was like, I had to get out of the room. It was absolutely, it was like something in a movie.
Yeah.
I need to go up the stairs. So I just remember, like, I just couldn't handle things. I was scared of everything as well. I was like dead jumpy. It was so weird. I had the POTS, the high blood pressure, slurring of words, brain fog, brain zaps. I had like zaps in my brain. It was like electrical zap. It was just, I mean, is this normal?
No, of course not.
Do these things happen, John?
It's bizarre neurological.
Am I making it up?
Your experience is your experience. That can't be questioned.
Jolts. I had all these jolts. The head pressure was absolutely through the roof. Tinnitus. The tinnitus was absolutely, that, my understanding is from the head pressure.
Yeah.
A chest pain. I think I said breathlessness, which I still struggle with, struggling to breathe. I remember one time, John, my good friend Alex Mitchell, at one point my diaphragm was that weak I couldn't even talk. I could only get out 3 words and I'd struggle to breathe. I just felt like I was dying.
Yeah.
I had low concentration, heart palpitations, still sensitive. Maybe I'm going over old ground here. Bad circulation, cold feet, hands were freezing, pins and needles, fatigue, extreme weakness, couldn't tolerate tablets. Everything I was taking on, John, everything I was putting into my body was just thrown back up. My body wouldn't regulate heat. I had terrible body odour. I was absolutely smelling. The black eye floors, MCAS, which is the mast cell activation syndrome, which I think is where the stomach issue came from.
It basically means there's a whole load of stuff you can't eat without a bad reaction.
Anti-inflammatory, antihistamine diet.
Yeah. Blood
pulling, and then I eventually get the diagnosis of myocarditis a year later. But to go, sorry. To go into when I discovered that it was the JAG.
Yeah.
Whatever the hell this thing is.
Yeah.
I don't even want to call it a vaccine, John, anymore.
That's what put a lot of us off, John. I mean, that's what anaesthetised me, really. You know, I've been given vaccines all my life, and vaccines are fairly safe. And then this was called a vaccine. You think it's just another vaccine. You know, some people were saying, well, you know, this could cause longer term problems, and I just couldn't see how a vaccine could possibly cause longer term problems.
Yeah.
You know, it was just this is new.
Yeah.
Okay, I should have rumbled it earlier. A lot of us should have rumbled it earlier, but
you were just going by the data.
It was new, and we were going by what we were told as well.
Yeah.
So when did you realise that it was the vaccine?
So when I went to the private, there's so much more, but you know, I'm really tired, and especially after last night.
I know you've had a big night last night.
After what I done last night, John, you know, I'm still kind of on adrenaline.
Oh heck,
and so I'm really tired. I'm still struggling. So I've done other podcasts in the past. And
we'll put links.
Yeah.
Yeah.
So I went to one of the private doctors, and there's other bits in this I really want to get in. When I was in the hospital, I was complaining about my heart. I remember arguing with nurses, telling me again. They told me a cardiologist came through. I've got the video on my phone. I'll bloody show you that as well. And I remember I was in there, and I thought again the heart was not good. And I remember I was like to the nurse, "Where's the cardiologist?" They said, "You've seen a cardiologist?" And I went, "No, I haven't." He says, "You have?" I said, "I haven't seen a cardiologist." Bear in mind, they've told me that everything's already in my head. Now you're telling me that the cardiologists are coming in to see me. So this was another part. No, I know I'm kind of jumping about. I'm sorry. It's just
okay.
I'm trying, you know. And I was arguing, and I've got, and then I went. She went and looked at her notes, and then she came back with a tail between her legs, saying, "I'm really sorry." And I said, "You're really sorry?" She says, "Imagine I was an elderly person sitting here, and then you're telling their children that she might be losing her marbles."
At least she admitted her mistake at the end of it.
Yeah, but it was an argument, John.
Yeah, you don't argue with your patients.
I remember being in hospital at one point. It was that bad, John. I had nurses bathing me at one point. That's how bad I was.
You couldn't do anything, yeah.
So anyway, when I eventually figured out what it was, there was... I went into this cardiologist, and he turned round to me, and he took me from a standing position to a sitting position to a standing position. And he turned round and he went, "Have you heard of a condition called POTS?" Which is the postural orthostatic tachycardia syndrome. And I said, "No." And I said, "What does that mean?" And he said, "Well, when you stand up, your heart rate's going high.
Yeah.
Your blood pressure's going high as well."
Yeah.
Now my auntie actually pointed out, because she was quite nursing, she actually noticed a while ago when we done a reading, went, "What are you doing right now?" I went, "Nothing." She went, "Because your heart rate is through the roof." It took 2.5 months, John, to diagnose that. And it took 30 seconds. And I was in and out of that hospital how many times, and I remember one of the cardiologists at one point came in and went, "You're not going to have another heart attack, off you go." He didn't really do his job, did he? So when that cardiologist said to me that he told me this condition, I said, what is this? What is this POTS? And he said, "Heart rate high." And he said, "When did this all start?" And I said, "About November time." And he turned around to me and he said, "Did you have anything different?" And I went, "Did you have any of your vaccines?" That's when I looked at him and he looked at me.
Yeah. Was this a cardiologist?
Cardiologist. Yeah. And
you both clicked at that point.
Well, I clicked. He wanted to click, but he didn't want to.
Yeah.
And I looked at him and then he said to me, and then I said to him, "Do you think it could be that?" And he went, "Well, we don't know." We don't know. But then at least I walked out with some sort of answer for one thing.
This is sort of mid-2022, is it?
No, this is January.
January 2022.
January 22. It took 2.5 months, or just about 2 months, John, to get a diet, just for the POTS.
Yeah,
Now, thankfully, I don't have this POTS anymore. So how the hell I beat it? You know, I don't know how much you want to go into my treatment and stuff. But it took 2 minutes to diagnose that. Why did the NHS just let me go in there, and they could have diagnosed that months ago?
And one guy diagnosed it in 2 minutes, yeah.
So then I go home,
started saying to myself, is this the vaccine? I messaged my mate Mick, and I said to Mick, oh, they think it's the vaccine's done this. And he went, I told you. And he went, you need to see this. And I went, what is it? He sent me the clip from Joe Rogan and Dr. Malone podcast saying that he then developed POTS from Dr. Robert Malone.
Oh, Robert Malone, yes.
Robert Malone and Joe Rogan, they had the podcast. And he said that he developed it from the Moderna vaccine, and then that's when the penny told.
Robert Malone had developed it.
Yeah. And that's when I had then listened to that podcast, and it made me go, now we've got a problem. And like I said, the timeline and the pictures, John.
Yeah.
If you're a doctor, they usually ask someone, what have you done different in the last 6 weeks?
Yeah.
Doctors aren't asking that anymore.
Yeah.
So then I discovered that. And I had the picture of me in the wheelchair, and I went home, I went onto Facebook, and when I went onto Facebook, I said what happened to me regarding the vaccine. It got shared, liked, everywhere, shut down.
Censorship.
It shut me down.
Yeah.
I mean, I don't know, why would you shut me down for something?
Well, that was Facebook, wasn't it? They were probably the worst for censorship, and Twitter was bad before Elon Musk.
Oh, I done was saying what a doctor had told me, and then I was just trying to tell people this is a possibility.
Yeah.
And I believed I was genuinely still dying, John. And then I started to try and speak out. I started to try and find others. I found others. They started to tell me about what you can and cannot say. I just felt like I was in a totally different world, John. And I said, why are we not allowed to speak about a side effect to this thing? Now bear in mind that heart issue was just one of the many side effects. And then when I started to say to doctors what it was, they didn't want to know. They didn't want to know at all, John, and I had no help at all. No help at all, and I kept begging for help and begging for help. They put me on a Vabradine for this POTS and never done anything. Now my understanding is, tell me if I'm wrong, John, I don't know.
I might not know, but go on here.
Regarding POTS, a cardiologist some cardiologists didn't even believe in POTS because it was so rare. Now I know this because I've spoken to them privately.
It was rare.
It was rare. They used to say they found it in people with viral infections, and they also could find it in people that had complications after vaccines, and they also had it in complications in women after epidurals. That was my understandings, and that's what they told me. And it was mainly women that used to get it.
Right.
And what they used to what my understanding is that normal POTS, standard POTS, because I know there's a whole range, but standard POTS is heart rate goes high, blood pressure goes low.
Yeah, that's what I thought.
And people pass out.
Yeah.
Not with the POTS I had. The POTS I had, the blood pressure was going high and the heart rate was going high. Now to go back to what we were saying with regards to the POTS and the myocarditis, that's what makes me think all these young athletes are having heart issues and dropping. Because I was an athlete before. You mix myocarditis and POTS, John, I mean, just common sense plays a big part, and especially when I've lived this nightmare. So that's when I discovered it was the vaccine, and it took a hell of a long way to get there, but where I was, John, to where I am is night and day.
Yeah.
I was bedridden for 14 months.
Yeah.
I spent over £40,000 for this to try and get my life back. I've done many alternative treatments to try and get my life back, and I've found a phenomenal doctor who's in Glasgow. I'd love to mention his name, but I'll give him a shout out because the man is a hero to me.
Yeah, I think if it's a good one you can say it.
I don't want to say it because I want to protect him.
Okay, right, okay.
So
that's fine. No, that's true. If it's a good one, it'll be inundated with people from around the world.
Well, a lot of patients, a lot of people I know have put them to him.
Yeah. And
to be honest with you, the man is...
he's made the difference.
And he's working along with other good doctors as well.
Yeah.
And I'll tell you the story quickly how I got in touch with him. I've said this before in another podcast. Now, John, I wasn't a spiritual person or anything like that. But I tell you, they always say when you've got nobody else to turn to, you're always going to pray or turn to somebody up there, now whether it's God or spirit or whatever.
There's not many atheists in foxholes.
Yeah, well, lying in bed, like I said, I was getting cared by my mother and everything. And someone messaged me on Instagram and they said, don't know if you're a spiritual person, John, or whatever, but my advice is you better turn to God or someone up there and you better pray. Went on to Amazon, John. I bought a cross. This is, I don't know, John, like, it's weird. It's weird how this happened. As soon as that cross came, John, I remember opening it up and I remember like it was just I was in my mother's room. I could look out the window and another one of those really nice blue, black skies at night, do you know what I mean? It's very... I remember grabbing that cross. I still got it. It's never left my neck. I still got it. It's never taken. It only goes if I've got an MRI scan.
Yeah.
And I swear, I prayed like nobody else, and I said, I promise you, right here, right now, if you can get me better, if you can get my heart rate back to normal, I make you this promise right here, right now. I will make as much noise about this as possible, and I'll try and help as many people as I possibly can, John.
Which is what you're doing.
It's no word of a lie. The next half an hour goes by. This young girl on Facebook, she said she was suicidal, and I reached out to her, and she was on another group. It was nothing to do with the vaccine. And I reached out to her and I phoned her, and I said to this young girl, I said, I told her what I was going through. I still get a message in my phone. And I spoke to her for 20 minutes, half an hour on the phone. I told her my life, what I was going through, and I think I was dying. I says, look, life isn't that bad, you know, if you can still do this and you can still do that. And she said, thank you very much for that, I really appreciate it. I then turned around and I messaged her and I said, do you know, I just done a prayer about an hour ago, and I said I promised I'd help people. I says, I don't know if that was a test. No word of a lie, John. 2 days later, this woman phones me up and she says, John, I've seen your story and someone's screaming to me, I'm very religious, and God's screaming to me to reach out to you, to reach out to this doctor. And
you got hold of the doctor?
I phoned the doctor, and that man came out to my house, John, in the bed. Thought I was dying. He reached over me, John, and he said, I'll get you. He spent 3.5 hours with me. 3.5 hours with me. And he said, I promise you I'll get you better, John. And he gave me protocols that have helped me. Ivermectin. It's taken a long time for me to get this way, John, but trust me, I'll everything to that man for you. Do you know what? See, even at the point, just to hear a doctor to say, I believe you.
Yeah.
To just say, I believe it's a vaccine injury was just...
Yeah. Not just writing you off as a head case.
That was the first moment, that was the first time I felt there's a chance here. And then after that, I done a GoFundMe. I was constantly still in a hospital, John. It's not like I seen him and I was better, you know. And when I found out what it first was,
yeah,
my friend sent me your video with Kyle Warner.
Yeah.
We both know.
Yeah.
And just to give you credit as well, John, that video gave me hope.
Yeah.
Because I knew how bad Kyle was. And my mate sent me it, and I got an understanding of the hyperbaric, and I was just like, if I can hold on for a year or whatever and maybe get better, that's, your videos are phenomenal, John, I'll give you that, and you help someone like me give a little bit of hope, because I seen Kyle's story, and so your video was one of the ones that I seen when I realised what it was, and I knew I could probably get better. But I say after that, John, I done the GoFundMe. Good people out there that seen my story, you all helped me, get better. I done a treatment called Goldic. The GoFundMe made like whatever thousands in 48 hours. I couldn't believe and nobody really knew who I was. I put a video out when I was at my weakness, the weakest I'd ever been, John. I can't even watch that video anymore.
No.
And I done a treatment called Goldic, and
John, we're going to do a separate video about your treatments.
I would like to get you the video to the doctor.
No, we're going to do that. But you know, it's been a long time, and you're tired now. Just, do you want to tell us what you've been doing for the last couple of days, and then we'll wrap it up?
Yeah.
For this time.
Well, I just want to say thank you to you, John, and everybody who's doing this, man. Just keep going, keep doing what we're doing. Obviously, you know, John, I've tried to do as much as I can to raise awareness on this matter. It doesn't matter how many times, you know, they want to shut me down on TikTok and YouTube. I'll just keep going. I've been on numerous podcasts, documentaries, Safe and Effective. People might say, you know, this guy seems to be everywhere. It's because I want to be everywhere now, John, because I said I would bring the noise, and this is what I'm doing. You know, I contacted Mark Sharman and said, please, I'm begging for help. I'm not doing this for likes or anything, John. I'm doing it for the right reasons, because people need help. And just like you, John, I do podcasts now. I call it the Bring the Noise podcast.
Just remind us the name of your group, the Scottish group.
So I've also set up a group in Scotland, which is the Scottish VIG. So Scottish VIG, Scottish Vaccine Injury Group.
Yeah.
I do that with a good woman called Ruth.
Yeah.
And Alex. You know, we founded that together because there's different rules in Scotland than there is in England. Our group is growing massively, and I haven't even touched on the MCAS. You know, I say if you're all out there and you're suffering from gut issues now, you know, if you've got these kind of stomach issues, and it could be the MCAS, which is the mast cell activation syndrome. But yeah, I'm trying to help people, and I'm trying to get these people heard. And obviously last night, John, I went to GBN News, and I had to, I don't know if the right word's confront Rishi Sunak, but these politicians, do you understand how many people you have harmed? Do you understand what he's, and the mainstream media as well? Do you have any, how you can all sleep at night and not acknowledge that this is a problem? And this, I reference back to the yellow card system, John, and you know yourself, underreported.
Massively underreported.
It's underreported, and how is anybody going to get a diagnosis to know when the doctors don't want to put pen to paper? And I'm sorry, your narrative of safe and effective, it is now gone. I don't know anybody that show me the data that saved a life. I've not seen the data to show saved anyone's life, because I know people that didn't take it and they're still alive. So does that mean it saved their life by not taking it? But I tell you what, I know thousands and millions globally that have been affected by it. And this, in my honest opinion, John, this has ruined the world for 70 years plus. Because if you're in a car accident tomorrow, you're not going to want my blood, are you? And, you know, we can go into other things. I've seen other videos, John, and miscarriages and everything else. I don't want to go into it, but... Yeah. And if you're putting your head in the sand, I'm sorry, do you want to know how this gets sorted? all the doctors and nurses out there, you all know what's going on. You've all got young people coming in with heart issues and you're all telling them we can't see anything on the MRI scan, you can't see anything on this scan, but they're coming in, but they say, I don't doubt your issues. Well, you don't know what you all need to do. You all need to start realising there's a problem, because it's not a coincidence. There's been a common denominator being handed out in the last 2-3 years, and this has went up massively. These issues, these heart issues in young people have went up massively, and it's time for you all to band together, and maybe you should all go to the GMC and say, we're sick of... Because I went in with a doctor one time, John, and I said to him, I feel sorry for you. I feel sorry. Do you know why I feel sorry for you? Because it's your reputation that's getting ruined now, because people walk out that door and say, that doctor's rubbish, that doctor's rubbish. You became a doctor to help people. So why don't you all band together and all stand together and say, enough's enough. We can all just admit that we got this wrong. I can't change it. You all can. And everybody just needs to do the right thing at this point, because I'm sick of doing it. I'm just wanting things done right, John.
Scottish word is scunner, isn't it?
Scunnered.
Scunnered, yeah.
Yeah,
is that enough? So, there was you and another guy, Adam. Last night, and the Prime Minister's going to look into your case personally, we believe, from the... Did they take your details so they could get in touch with you?
Nobody took the details. We left last night. When I left last night, I left off my, I couldn't sit there, John. I was too frustrated. Yeah. I did turn around to them all behind me, because I knew they were all looking behind me, the studio people, whatever, the floor managers. And I told them, I says, this thing's giving me a death sentence. And I said, and it's killed millions. And I just, at that point, I got up and left, and I went outside, and the police approached me. To be fair, the police were nice, but they approached me. You said, you John, and I was like, yeah. And I told them, and they were like, look, we've just seen it. And I said, look, I'm not doing anything. And they said, do you want to get out of here? And I said, yeah, and they went, well, we'll give you a lift. Where are you going? And I went, I'm going to the station. And they went, you jump in. I said, with all due respect, I do not trust any of you at this point in time. I said, so not a chance in hell am I getting a taxi in the back of a cop.
I'm sure they were just being nice to you, but
I think they were. But at the end of the day, I was not. Yeah. And I was telling them what was going on.
I mean, what's sad to me there, John, is that as a British citizen, you have completely lost trust and faith in the authorities.
100%.
When you were a little boy, that your mum would say, well, if you've got a problem, ask a policeman.
Yeah.
And that's still mostly true, but the fact that you felt that way is what's disturbing to me, really.
Well, of course, but I mean, yeah, in my opinion now, this is a crime. Mm. The authors do no harm. Mm. One of the side effects is death. Mm. You can't get any worse than that, John. Mm-hmm. And there's people unexpectedly, unascertained, I believe they call it. Yeah. These people just passing away. 27-year-old rugby players just passing away. Yeah. Celebrities every day passing away. Now, people do pass away, but not to the levels they're at now.
There's been excess deaths for quite some time now, yeah.
Adam came out eventually, and what happened was Adam said, oh, they're willing to take our details. Mm. And we tried to get back into the building, but they wouldn't let us back in. I said, I don't see how, and they went, and I said, it was me that left. I said, I walked out, I left the situation. But message to Rishi Sunak, you've now been notified that the vaccine injured and bereaved exist in this country. Mm. So it's time for you to do the right thing. Like I said, I told them to look in my eyes because of the pain and trauma. Mm. You have ignored this for 3 years, not 1, 2, 3 years, mate. Mm. Yeah. And it's me, and the honest answer is, John, it's me that's picking up the pieces. Why am I picking up your pieces? Humza Yusuf as well. Why am I picking up your pieces in Scotland for the thing that you all could advertise for the last 2.5 years, 3 years? But it's the one thing we can't talk about now. But we can all blame COVID all day. But again, we go back into the protocols with all that. But it's time for all of you to realise, and I tell you what, it's not just one political party issue, it's a political issue. And the honest answer is, I can't trust any of yous now because not one of yous have. I mean, there has been one or two now that are speaking out.
Yep, there is.
But see, if you want the public on your side, it's time for you to actually stand up and realise we've got a problem on our hands. And the thing that you're still continuing to hand out, nobody should take it. I mean, John, I don't know, is there any evidence to say that this thing does what it does and saves any lives?
I mean, what I'm very comfortable saying now is the risk-benefit analysis, whatever it was at the beginning, has changed so massively I wouldn't even consider any form of mRNA therapy at all.
I mean,
of course, the original ones you took, the AstraZeneca, we've dumped them years ago for being too dangerous for the side effects. I mean, that's beyond dispute, isn't it? We no longer give them.
Yeah, but you know, the data has just been so manipulated.
Yeah.
Even the clinical trials originally.
Yeah.
But why can't people just see that what you're doing in these videos is telling people the truth and the facts?
And talking to the experts. I mean, I talked to Joseph Freiman in the States, who's reanalyzed the original papers, and you know the stuff he comes up with it's all there in the paper. It's mathematically demonstrated, and you know the risks were just so great that, in my view, they're now unacceptable. In regards to, I don't want to go off subject, but regards to cancer, I know people in my own circles now that are suffering from cancer. You know, a lot of people do. I do. Mm-hmm. I had a good friend die, and you can't say that's what it was, but so many people are saying the same thing. Well, you know, we need this put together in good quality national epidemiology, and it's simply not being done. Well, in my whole life, John, my auntie had cancer, my mum. Now round about me, people, and there is one story, I won't name names, but I know one story. This girl's sister went into hospital, and this isn't me making it up, this is fact. Her sister went into the hospital, they discovered she had cancer. She died on the Sunday, or the Monday. It was that aggressive. Like, this thing. Whereas normally cancer would take weeks, months, years. Common sense, but there does seem to be a lot of people dying more acutely of cancer, and a lot of defibrillators everywhere now. You know, when I never seen a defib. No, they've been around for a while. You're probably just more aware of it. But but yeah, I mean, there is so much to cover in regards to what I've been through, but I've been through hell and back, John, to be honest with you. But I don't know, I'm just praying that what I done last night maybe just start to get people on my side, but I've not seen any mention on any mainstream media yet, to be honest with you. I've not had a chance, but my understanding is I don't think there's much on mainstream media. I think I've been told that Good Morning Television said I was an anti-vaxxer. You've had 3 vaccines? I had 3 of them. These and you had all your childhood vaccines, you had your measles vaccines, your BCG and all that. I mean, and you've got 2 children, John, I believe. Yeah. Did you have them vaccinated? Yeah. As normal childhood vaccinations. You don't question these things, John. No, but I mean, but if you had them, if your children had the normal childhood vaccinations, you are not anti-vax because you vaccinated your children. That's what more can you say than that? But the honest answer is no. I don't trust you. And that's the problem. We've lost trust in the medical industry. We've lost trust in. It needs to be stripped back. 2020, the world's gone mad, John. I really think big parts of it have. Common sense is long gone out the window, mate. Yeah. John, people can watch this video in combination with your chat. My chat? With our Prime Minister yesterday. Yeah. We're going to leave it there. We're going to meet again. We plan to meet again. I know you want to talk about me, which will be really boring. I don't think so. But you're welcome to do that, and we'll try and get a time when Ruth's there as well. Yeah. Well. And I plan to come up and do that with you and Ruth. I mean, like I said, John, I was bedridden for 14 months. Yeah. And I was literally just waking up every day. I said I'm very tired. You know. I'm still emotional, John, after what of course. I mean, it was a massive
Yeah.
A massive thing.
But the one thing I'll say, John, before I wrap up, it's time for everyone to stand up. It's time for everybody to just do the right thing. And I say it, John, bring the noise. I mean that. See, if you're anyone that's suffering from this, don't be scared.
Yeah.
Don't feel ashamed because you've told a family member to take it now. And that, look, this is the problem with society now. We just can't admit when we get it wrong. I can admit it. Was I fooled? Yeah.
Me too.
We can, at least we're admitting it, John.
Me too.
And see, if we did, we can all say we're sorry. But the people that need to be held responsible is either government or MHRA.
Yeah.
But thank you very much, John.
Thanks, John. It's not easy to share your suffering, but you've done so. Thank you.
Thank you. You got it to me.
I hope that's all okay.